Um, we are live. Welcome. Welcome to our pet Q&A for tonight. Tonight I'm going to be doing it alone. Joni sends her regrets, but circumstances beyond her control don't allow her to be with us tonight. I'm having some technical difficulties. If you're noticing, you're seeing the side of my face instead of the front of my face. I've got two monitors, and for some reason I can't get the other monitor to work right, so I hope that won't be too distracting for you. Tonight's topic, I think, is a very important topic. It's honoring the human-animal bond, rituals, meaningful goodbyes, and end-of-life transitions. And I want to talk a little bit about that. First, to let you know that we will have a promotional code available to you, Forever Friends 25, good until Halloween, till the end of this month. So good for any product on our website. And I also wanted to give you a little disclaimer as far as the Q&A part, that any that I want to do my best in answering your questions and to be helpful to you and your pet. But because we don't have a doctor-patient relationship, I don't know enough details and facts about your pet. It's hard for me to be precise, and so please understand that this is not medical advice, but is educational information that hopefully will be helpful to you. Now, let me talk just a little bit about our topic, honoring the human-animal bond. And I would say that, as a veterinarian, probably the two most important times in my career when I'm visiting with clients is when they bring that new puppy in, which gives me a great opportunity to get them set up with wellness programs and establish a relationship with the client and with the animal. But the other most important time is when we are dealing with these end-of-life issues. And I will say that these end-of-life issues are probably much more difficult to deal with than the puppy issues. And one of the biggest problems that we have when we are talking about end-of-life issues is trying to decide if it's time or not. We've been talking a lot about wellness. We've been talking about longevity strategies. We've been talking about lifespan and health span. But really, it is this part of the life and the relationship that you have with your animal that really is so impactful. And so one of the things that I do when I start talking with clients about this time, and hopefully it's not, in the 11th hour when everything's an emergency and they just bring it in at the last minute and I haven't seen the pet very much, is that I try to give them some guidance regarding what things to look for that may give you guidance to know that it's time to say goodbye. And there's a survey called Hospice that was created by the first veterinary oncologist who was a woman. It's like a scale, a numerical scale that you use to grade different qualities as far as activity, as far as stools, as far as pain, things like that. And then you sum up all of those values and you average it, and that helps to give you a consideration as far as what is your pet's quality of life and is it time to say goodbye. It is one of the most difficult decisions that anyone has to make, and no matter how hard you try to make the right decision, you're always second guessing yourself around that. But I would say looking at some objective parameters, objective criteria to use when you're trying to decide when it's time or not are very important. And when it does come time, and for many years I did house calls, and one of the things I did on my house calls was also these in-home euthanasias. And I would oftentimes counsel people that it would be great to have, like a little eulogy around the animal, at the time where you can set up, pictures and mementos and things from the animal's life, maybe even a little scrapbook, to kind of remember not this very difficult time when the animal is probably not doing so well, maybe suffering, maybe painful, may have been that way for a while, but instead to remember the vibrant times that you shared with the animal. And it's these vibrant times that really are what make up this human animal bond, this love bond that you have with your pet. It's never easy to say goodbye. And it's always associated with tears and with grief. And the grief is really important. It's said that the body sheds the tears that the eyes do not. And it's important to allow yourself to feel the grief and to feel that grief for a long enough period of time that you honor the love and the time that you spent together with your critter. So I think that's probably a pretty good little summation of this particular topic, a very difficult topic to discuss, but one which we will all have to face, whether it's with our beloved four-legged friends, family members, or our good friends, because none of us gets out of here alive. So anyway, why don't we start with the first question? Looks like you got one up here. I'm going between the screens so I can be looking at the camera, but I need to look at this monitor to see what the questions are. Okay. Why do some people feel their pets passing more deeply than the loss of a human loved one? And how can we honor that without guilt? So I think that the answer to that question is that in spite of how deeply we have love for a human friend or family member, that pets give us something that no other human can, which is unconditional love. I mean, they're always happy to see you. You know, you could be out of the house for 5 minutes and come back, and it's like you've been gone a week. So I think that's probably the essence of why we can feel a greater loss. That's not always true. For some people, it's not quite as impactful to lose a pet as it is to lose a good friend or a family member. But that's my reasoning behind that. Would be that it's because of the unconditional love that our pets give us. They weasel their way into our hearts, into every cell of our body, into every fabric of our lives. And when we lose that, when they're gone, it's huge. It's huge. What questions should we ask our veterinarian to make sure we're making compassionate, informed choices? Well, I talk with clients about 5 criteria that I use in order to determine whether it's time. And first of all, is the animal eating? Is it able to eat in spite of all the efforts we've made to encourage it to eat, whether it's changing food or using some drugs or using some herbs or using acupuncture or all the different techniques we have to increase appetite, still not eating. 2, is it in pain? And is the pain something that we are unable to affect? Because there are, in spite of all the good drugs and all the good supplements and all the good acupuncture and different types of tools that we have to remediate pain, there is some pain that is next to impossible to deal with. And if your animal is suffering from that kind of a pain that we can't help, that is a good criterion to use. Another one is, are they continent? Can they hold their stool? Can they hold their urine? If they can't, and we've tried a number of different approaches to fix that, and they still are losing it, well, that's another criterion. And there's a criterion that adds on to that, which is that, can they move? Do they have mobility? If they don't have mobility and they're still lying in their excrement, there's no honor in that. There's nobility, no nobility. And that, to me, especially the combination of those two, is a very strong testimonial that it may be time to say goodbye. And then the last one is, are they conscious? Are they able to perceive your love and your presence? And I've had a couple of clients, not very many, that had animals that were in comas that insisted on continuing to care for them, even though they had really no consciousness, and as far as we could tell, no hope of regaining consciousness. And I think if you look at those 5 criteria and maybe go for 3 out of 5, I think you need to be objective about it. And that's what you need to ask your veterinarian, because some of these things you're too close to your animal to know. The veterinarian may know. Certainly if there's cancer, if the blood tests all show things that are pretty bad, that's really good too. And lots of times I'll recommend that we do that testing, and people say, why should I spend that money, doc? It's the end of his life. We're not going to be able to do anything. But it's not always about doing something. Sometimes it's about knowing. It's about knowing in an objective way with a blood test or some kind of testing that is objective and not biased with our emotions, gives us that license to say, I don't want to do it, but it seems like it's time. It's really best for my beloved animal. So that's my answer to that question. What are the best mushrooms for a 10-year-old male Aussie with low stage 2 chronic kidney disease, creatinine 1.7, and he's been steady at that for 4.5 years. So this is a very low-grade chronic kidney disease, which is good, and it's been stable for these many years. So my opinion would be to use the cordyceps mushroom, or to consider the daily dog, which has cordyceps in it, in a very palatable format, and to use that. And then, of course, depending on the size of your animal, the amount that you would be giving would be dependent upon that. And we'd probably give a little more than we would give for wellness, because we want to have a better impact on that kidney. How do animals mirror or teach us about presence, love, and letting go? These are interesting questions. Well, really, animals are our mirrors. We see ourselves in them, and because they are unconditionally loving, and because they are loyal and faithful, and many times protective as well, they definitely teach us a lot. They teach us about unconditional love. As I mentioned, it's hard to find unconditional love from humans, no matter how close you are to them. And yet that is ultimately, I think, the goal in true interpersonal relationships, is to be unconditionally loving of each other. So in that regards, we can look to our pets and learn from them how we can better treat our fellow humans. And I guess the letting go part is really, as we are losing them, and as we become aware that we are losing them, we have to learn how to let go. I know of pet parents that still mourn in a way that may be a bit dysfunctional for them, pets that have passed away years and years ago. And I think sometimes it goes beyond honoring your life together with your pet, and people can sometimes get into this downward spiral of emotions without realizing that the pet was I wouldn't say happy to go, but pets are in the moment. They are here now. They are very immediate, and when it's time for them to go, they go across the rainbow bridge and are forever in our memories, but are free to wander freely, in the ethers. Next question. Well, again, these are all similar questions, and we need to be able to have an objective way. How can we balance our pet's comfort with our own desire to hold on, is the question. And really, I think it is creating some objective measurements about your animal's suffering, whether it's pain, whether it's inappetent, whether any of those reasons why I've given that it is time for them to say goodbye. And I think that this is one of the strongest callings that we really need to have during the life of our pets, is to learn to let them go, to love them enough to let them go. And that is a hard lesson. I can't say that it's a lesson that I have learned easily either, but at least to aspire to that, I think, will make us better people and better pet parents as well. I almost killed my cat. I put Clorox toilet cleaner in the toilet and left it to sanitize, then got busy. Later, my cat came staggering, his eyes watering, and wasn't well. The next day, no food, water, and vomiting. So this is obviously a little bit it's maybe this is talking about getting to the end stage point, but we need to be mindful around our pets, especially curious critters like cats, or maybe animals that are drinking out of the toilet, which is not an uncommon thing. We need to be mindful, and life's busy, we got chores to do, cleaning, phone calls, all those things happening, texting. But we have to remain mindful because this is part of our commitment to our pets. It's the commitment that we have from the moment we adopt them when they're younger throughout their entire lives, as far as providing them with mindful and healthy, um, healthy care. And it's also the mindfulness that we need to have as their life is declining and as they're reaching that end stage point. Sorry, you need to take the cat to a veterinarian and have them check it out. Maybe it needs fluids. Maybe it needs to have some protectants given to its gastrointestinal tract, because the Clorox, depending on how dilute it was, could just have irritated the digestive tract, and the cat will get over it. Or if it weren't dilute enough, could cause some caustic burns to the entire digestive tract. And in which case, if it's not too far gone, there are medications that the vet can give you that are soothing, that will help to protect and allow the damaged lining of the digestive tract to regrow and become healthy again. What are holistic or alternative approaches to keeping pets comfortable in their final days? Well, there actually are quite a few, and I actually do a lecture to veterinarians about the value of mushrooms as well as CBD during these end of times for your pet, because there are a number of studies that show that mushrooms can actually help with the anxiety and with the anticipation. They can also help with the inflammation and some of the discomfort, although I would just use mushrooms alone for those. Likewise for the CBD. Acupuncture can be a very good tool to use to help improve your animal's sense of well-being and quality of life and reduce pain. Canine massage is a great approach as well, to help, because that hands-on physical approach to your animal's discomfort. And certainly talking to your animal, they understand what we say to them, touching them more, comforting them, making sure that they're eating, providing them with food that might be special for them. Don't give them very rich food, but give them a high protein food that they may find very tasty, that maybe you had withheld for sake of their weight or things like that during their lifetime. And there's hands-on therapy like Reiki and Touch for Health. Crystals themselves can have healing powers. I mean, there's a lot of ways that we can provide comfort outside of the realm of conventional medicine to help our pets make their transition. Certainly, the use of flower essences, rescue remedies, very simple, but there are other flower essences that can be put together. There's calming herbs, calming essential oils. There's a lot of different tools that we can use to help our pets. Pulsed electromagnetic force is one modality that I've been exploring quite a bit, both for my aging joints, but also for Ollie's aging joints as well. And it can be a very good non-invasive way. And they have these loops, CZ loops that fit over the head that actually help to reduce anxiety and induce a calming effect. So something like our relaxed chews, which have reishi and lion's mane, which are great for centering and grounding and relaxing, but it also has tryptophan in it, which is a calming amino acid and has herbs that are calming, can also help during this time period to settle your pet. And I didn't mention this, but it is very true. Our pets feed off of us. And so it's also important that you take care of yourself during this time period, and that you attend to your own anticipatory anxiety and your anticipatory grief over the loss of your animal. And I encourage you to seek out a close friend, or seek out a pastor, or seek out a counselor, or whatever, whatever kind of other person you resonate with who can give you some support. Because, as much as you were talking about the support for your pets, you also need a lot of support during this time period. And the stronger you are inside naturally, the better, the more your pet will feel that and will do better as well. You guys planted all these questions, didn't you? What are some creative ways to memorialize a pet beyond the usual photos or urns? For example, planting trees, creating art. These are all ways. When I was referring in the very beginning, about a scrapbook or having like a little altar or a way to kind of memorialize your pet while they're still alive, or even at the moment that we are going to be doing that in-home euthanasia. And I certainly recommend in-home euthanasias over taking your pet in to the veterinary clinic, a clinic that they may be a great clinic, but it's likely that they don't have the best associations going there. Being at home amongst loved ones, making a nice big old blanket that they can lay on, maybe having some food and treats that they like. Everybody's around there loving them up, having your little altar and your little memorabilia types of things, your scrapbook. It makes the event, it takes what is a yucky event into something that you can memorialize and you'll remember. And, and if you can, if you can measure your steps as far as having enough advance notice that this is something to do, and get the advice of enough people in terms of making your decision to let your pet go, then it's something that you can look back on in the future as a sad moment, but a moment that you feel good that you did it the right way. Catherine asks, do you recommend, if there are other pets in the household, like dogs, to be present during the time of saying goodbye? That's a really good question, Catherine. And I get I get that asked quite a bit. And I think that it really varies. I will have to say, I don't think there's a blanket response to that. It really depends a lot on the type of relationship that your dog has had with the other dogs in the household, or the cats. And cats can be a bit aloof, but not always. And you need to ask the other pet if they would like. You need to invite them and ask them if they would like to join. But don't force them to be there. And when Violet, our German short-haired pointer, needed to be euthanized a couple of years ago, and Ollie was much younger at the time, and we did it outside under a tree. It was a lovely setting. I think I even have some photos somewhere of it. I asked Ollie, I said, do you want to attend? And he was like, oh, I don't know. And he kind of, he was kind of everywhere, but not really there present, but although he was a bit interested in Violet's food. Also, this is where the value comes in from the gifts of an animal communicator who can talk directly to your pets, talk to your pet who's passing away, or talk to the other dogs in the household and see what they think. Is it something they want to do or something they don't want to do? And, as woo-woo as it might seem for a conventional vet, I find that animal communicators can be a very valuable partner in almost every process that I do throughout the lifespan, of my patients. So, and I've got some, I have one that I've been using for 30 years that if you reach out to me personally, I'm happy to share her contact numbers with you. How do we manage symptoms like loss of appetite, mobility issues, or breathing difficulties? Well, we manage them as best we can. And I think at this point in their lifespan, using a conventional pharmaceutical, which we might not want to use when they're not at the end of life and when we're more worried about the long-term effects, may be the appropriate way to go to keep them more comfortable. Don't like the use of steroids, but at this point in life, steroids could be very comforting to the animal. We don't really worry about the long-term consequences of that. But I would, of course, choose the gentler approaches first. And, as I've mentioned a bit, the acupuncture and herbs can be helpful with appetite. Some people think that THC can be helpful for appetite in pets. I we get variable results with that, but you want to be careful not giving too much THC because it can really adversely affect them. So, but CBD is certainly a good choice there, Um, and sometimes just improving appetite can be changing the food or warming the food up so they have that aroma. Mobility issues, those can be a real problem, but they make slings that allow you to lift the animal up. I'm thinking about this for Ollie right now because he's reaching that point, with his bad hind end. I can't see just putting him to sleep when he's mentally sharp, but he can't move around. So I'm also going to be looking at maybe getting a wheelchair for him if he would accept being in one. That's the other piece. Um, breathing difficulties. Breathing difficulty is one of these are one of the most serious of these kinds of problems, and might be best addressed, with an inhaler or with medication to improve that. But we do know that cordyceps mushroom, for instance, is very good when it comes to the lungs and to breathing and to asthma. So is reishi. So those could also be used, as well as pharmaceuticals. Wow, you guys are really doing it here. Okay, so the euthanasia process, and I've done many of these, and I think I was pretty good at them at the time. I'm glad I don't have to do them anymore. But when you do house calls, it's oftentimes what you're asked to do. So, when I would come into a house, I'll just tell you what I do. When I come into a house, I will oftentimes will hopefully I have a relationship with the pet parents and with the animal, and we've already made that decision, and we've already had some conversations perhaps about the setting that I've described regarding on a blanket and some food and some memorabilia and friends and families and dogs yes or dogs no depending on what they say. And so I'll come in and we'll sit and we'll talk a while. I don't just come in and do it. I like the animal to feel adapted to my presence and to feel comfortable that I'm not there to do something nasty to them. And then I do it differently than many others do. Many will go ahead and put a catheter into the vein of the dog. I feel that kind of stresses them out unnecessarily at home. So what I will do is I will give them some conscious sedation with a very thin needle. They'll barely even feel it going in. And we just sit around and talk until the animal gets much more sedated and gets to be a little bit out of it. But while it's going down to that state, we're loving it, we're petting it, we're talking to it, we're giving it all the pluses that it needs to hear, all the contact and love. And then at that point, when it's not as conscious, that would be when I would put an IV catheter, usually into the vein in the arm. Although some animals, it can be difficult to do that, and that's always the challenge, is getting the toxic dosage effectively, easily, and quickly where it needs to go. But hopefully we get that little catheter in, and then I wait until the pet parents are ready for me to do that. It might be 30 minutes or longer. Let them talk, let them get the emotions out. And then the euthanasia solution, um, oftentimes is a very strong barbiturate, which basically causes respiratory arrest and can cause cardiac arrest at the same time. They are already out of it. It happens within seconds, actually. We listen to the heart to make sure that has stopped. We give it more time to circulate. And then at that point in time, I leave the pet parents with their animal if that's what they would like, for as long as they would want. And then I ask them to leave because we oftentimes have to put the animal in a bag. It has died, it may be leaking different bodily fluids, and we're going to be taking it. If they're not burying it themselves on site, then we'll be taking it probably to a facility that might do heat cremation. We now have water cremation available, and then have those returned to them And there's many different ways it can be returned to, again, memorialize the dog, different types of urns, different plaques, things like that. It's a big process. And I know that there's some vets these days, and there's some vet franchises like Lap of Love, for instance, which has vets all over the country that do it according to their approach, which is a very well researched and good quality approach, that just do this kind of work alone. And they go, you can call them out any time of the day or night. You pay a pretty penny for that availability, but they are really very well schooled at doing this. And I think that you wouldn't be disappointed from that experience. Can mushrooms help pets recovering from surgery or illness? If so, what do you recommend? Well, I think yes. I think mushrooms definitely can help with the entire recovery process. They're superfoods. They're filled with very healthy nutrients, plus they have the ability to improve immune system function. And, if we're dealing with wound healing, beta glucans, which are the polysaccharides in mushrooms that have that immune stimulating benefit, will also help to improve wound healing in general. Mushrooms are known to help improve quality of life, as well, give them a sense of well-being, and also can help them overcome if there's any residual, if it's an infectious process or residual inflammation. Mushrooms can help with that as well. I think part of a combination program, I don't know if I would depend on a mushroom alone. Certainly, if they've been ill or been under surgery or things like that, they may also have been given antibiotics, which can be really difficult for the microbiome. So we do want to make sure that we're also giving very potent, high potency, high bacterial count or fungal count probiotics at the same time. We might even want to look at some point in terms of looking at a microbiome restorative therapy, which are different approaches we can use to improve the microbiome, which governs health. We know that mushrooms themselves, the fiber in mushrooms, really helps improve microbiome health and function as well. And we have a lot of products. I think, the Daily Dog, the Functional Feline, because they have live probiotic cultures in them, the Saccharomyces boulardii, which is well researched, because they have 7 different mushroom extracts at good levels. They've got adaptogens. They've got krill meal. And krill meal is an amazing extract from the plankton, from the krill, because it's really rich in marine lipids. It also is really rich in choline, a form of a bioavailable force of choline called phosphatidylcholine. It's good for the heart, good for the liver, good for the brain, good for the nerves, good for behavior. And it also has a very potent antioxidant that comes from marine algae called astaxanthin. So you might want to consider those in that kind of a situation, using, of course, a higher dosage than we put on the label, because it's not just for wellness, it's actually to affect some change. And let me remind you, we've got a discount code. Please feel free to use it. It's good till the 31st of October, which is about, 8-9 days from now. Forever Friends 25% discount. That's pretty good. Donna B asks, can any mushrooms help with narrowing of the trachea and arthritis? My 13-year-old pup is on a high dose of turkey tail because last year we removed a subcutaneous hemangiosarcoma tumor from his chest. Okay. So the narrowing of the trachea is commonly a mechanical or a physical problem. And in some cases, with some animals, it's not necessarily narrowing, but it's a weakening of the membrane that covers the trachea. And the trachea is not a completely closed circle, but is more like a D shape that has this membrane over the top. And so in some animals, that membrane gets weak and can create coughing. We call that collapsing trachea, but it's not the same as a narrowed trachea. And unfortunately, a mushroom's not going to help with that, although it could improve lung function. It may enable the lungs to be better able to utilize the oxygen, so they don't have to move as much air through that narrow trachea into the lungs. And we do know that mushrooms do have an analgesic effect, reducing pain for conditions like arthritis. Certainly not as a standalone, but in combination with other with other approaches, including using CBD to help with arthritis, along with mushrooms, using green-lipped mussel. We have a mobility chew formula that you might be interested in, which has 3 mushrooms in it and also has boswellia in it, green-lipped mussel, as well as MSM, all of which can help with mobility. And it's fairly new on the market, but we've been getting some very good testimonials back from pet parents who have been using it for their pets with mobility issues. I'm sorry about the hemangiosarcoma tumor. I hope that it doesn't come back, which is a good reason for you to use the turkey tail. And I would suggest that you make sure you're giving it a substantial amount of the turkey tail in order to be sufficient to help protect it from the recurrence, of that tumor. What type of diet is best for supporting kidney function? Well, that depends a lot on how severe the kidney function is. When we have, mild reduction in kidney function, we don't really have to do a lot of protein restriction. But one of the problems with feeding protein is it also is very high in phosphorus. And of the nutrients that are available, it's really the phosphorus that drives chronic kidney disease. And so we want to look to be able to feed foods that are lower in phosphorus, which is not that easy because phosphorus is an integral part of DNA, and DNA is in every cell. But we also have some types of molecules like aluminum hydroxide, for instance, which will help to bind up the phosphorus in the bowel so that they don't absorb as much from the meal. But as the kidney disease gets to be more severe, as we get more towards what we might call it as being end stage, at that point, we really need to start reducing the protein level to a larger extent. But we have to balance that against whether the animal is muscle wasting or not. Because oftentimes with kidney disease, they'll also leak protein from the kidneys. And so we need to be able to replenish enough protein so they don't muscle waste, but not so much protein that it contributes to higher phosphorus levels. So it's a dance, and I think it's best done with the advice of a nutritionally minded holistic veterinarian. Most conventional veterinarians are just going to reach for that diet up on the shelf and not really do more fine tuning as regards to individuality of your pet's condition in terms of the kidney disease. Oh. How would you introduce dosing a new mushroom or herbal formula for a dog with nasal cancer already on a lot of therapies? Well, MJ, I think that would really depend a lot on how accepting this animal is, of all these different therapies and how its appetite is. Certainly, there are mushroom powders, which could be blended in to the food so that it wouldn't put an additional burden on the number of capsules or supplements or things that you are already adding to the food. And all mushrooms are good for cancer. Some we might think are more specific for one type or another. So one could choose a mushroom that is more palatable for a dog. Reishi is a great mushroom, but it's awfully bitter. Might be hard to add that into the diet. Cordyceps or lion's mane are great mushrooms and very, very palatable. And they've got really good content of beta glucan and triterpenes, which would also be helpful as far as addressing the nasal cancer. So that would be my recommendation in that regards. We are going to be coming out soon, actually, with some powder formats of our single mushrooms, our turkey tail and our lion's mane, and also our 5 defenders, in which they're going to be blended with a lot of krill meal. And as I mentioned, krill meal is an amazing nutrient. It's got great value for cancer patients. and also helps to make the palatability that much more easy. So those are in the pipeline. It may be a while before we actually see them on the shelf, but that's something. One reason why we put those together is for this very reason. How do we know when or if we're ready to bring another animal into our lives? Well, we're talking about end of life and saying goodbye to one animal. And I always encourage pet parents to wait, to allow their emotions to recycle. Because, and some people will just bring an animal right in because they can't stand to be alone without that animal. And that's okay too. I mean, you need to take care of yourself. And if that's what you need for your own emotional support, I think that's important. But if you're trying to be a little more nuanced about this, then I think that some introspection on your own, maybe going to some shelters or going to look at purebred dogs or things like that could be one way for you to feel how you feel. Because I know I've heard some people say they feel like they're betraying the animal that's passed away by getting a new one. And so there is a period of time that it takes. When I lost Trigger, which was my chocolate lab rescue dog that was blind at both eyes, 90 pounds, and had bad knees and hips, but he wound up passing away from a pulmonary carcinoma. I waited nearly a full year. And I knew I was ready when I was looking at this newsletter from one of our lab rescue groups, and I saw this picture of Ollie, and I go, I want him. It's like it just felt right at that time. I would say you're better off waiting a little longer than not as long, to make sure that you are ready to welcome that new critter into your household, which is a joyful event. How can we tell what our pets are trying to communicate to us? Well, that's a really good question. Again, I say maybe speak to an animal communicator who has that gift. Terry, my communicator friend, she said when she was a little girl, she told her parents the animals were talking to her. And they were actually very understanding, didn't go, oh, that's crazy. And so I think it's a gift that some folks are hopefully lucky to have. We don't all have that. So we have to look at their behavior. We have to look at things about their behavior and how things change with their behavior. Now, Ollie and I have gotten to be close enough that when he wants to go out, he looks at me and then he looks at the door. He looks at me, then he looks at the door. So there's these little things that animals do. I mean, this old-fashioned thought that animals are dumb, they can't communicate, they can't think. That's not true. Animals are every bit as intelligent as we are, but within their own, species, animal context. So, you need to ask them, do you want to go out? Be observant, be observant and try things. When he looked at me and looks to go outside, I'll let him outside. But sometimes he'll stand there and turns out he wasn't looking at the door, he was looking at the food bowl. So, I think being observant and being sensitive and asking are the best ways to do that. So yeah, MJ, yeah, and so you were just asking. I get it now. I'm sorry, I didn't get the complete answer to your question. Thanks for re-asking it. Yes, and for anything, for any animal receiving any amount of anything, I always recommend starting low, going slow, and gradually taking your time, maybe a week or two, to get up to what would be considered the optimal dosage, or at least a good starting dosage. So, let's say it's half a teaspoon twice a daily is what we decided would be the optimal dose for the critter. Maybe starting with, depending on how sensitive they are to new introductions, whether they have a sensitive digestion. That's one reason to take it slowly, because you don't want to give them a lot and have it cause diarrhea. It's going to be a lot harder to get back to giving them that again the second time. So, half a teaspoon, maybe start with an eighth of a teaspoon or a pinch or a quarter teaspoon. With some dogs, it's not going to take long. And you guys know who they are. With other dogs, it can take longer. But yes, absolutely. Thank you for re-asking that question, or further defining what you were asking. Which mushrooms best support liver detoxification and regeneration? Well, the reishi mushroom has the most amount of studies showing its support of liver um, liver detoxification and regeneration. It helps to protect the liver from toxic damage. The cordyceps mushroom would be the second that I have seen in studies supporting that role as well. So, but I wouldn't depend on mushrooms alone. There are many ways that we detoxify. The daily dog and the functional feline both have milk thistle seed, and they also both have cracked cell chlorella, both of which are the milk thistle seed is good for the liver, and the cracked cell chlorella is good for binding up toxins and releasing them. So we have a little bit of detoxification function even in those two very palatable meal toppers, the daily dog and functional feline. Can liver problems be reversed or are they typically chronic? Well, it's a good question. And really it depends on what the liver problem is. The liver is an incredibly forgiving organ in terms of its ability to regenerate, renew, and and um, and and become a healthier organ than it was. So it depends on what's going on with it, how long that's been going on with it, and whether and how much of the liver mass has changed from functional living cells to fibrous scar tissue, because that's what happens with the liver as it continues to get sick and be toxic. The cells die and convert into fibrous tissue. And that's what we call cirrhosis of the liver, when all the functional cell, well, not all, but enough of the functional cells of the liver have died and been converted into fibrous scar tissue. But I've had a great deal of success when I was working more in the herbal field using milk thistle, using silymarin specifically. And there's a number of new tools that are available in supplement wise, as far as SAMe and silymarin and artichoke and alpha lipoic acid and N-acetylcysteine, a variety of different tools we can use to help support the liver. And certainly the liver is supported very well by diet. Almost every single nutrient that you ingest goes through the liver. So it nourishes the liver, and then the liver also takes those nutrients and modifies them metabolically to make them more useful for the body as well. So good food, absolutely essential. I would, definitely not feed them the crappy kibble. Anything ultra processed is not good for the liver. And something as simple as fish oil, for instance, and flaxseed oil, the healthy oils, also can be very, very healthy for the liver, as well as mushrooms and herbs that we use typically to help improve liver function. So yeah, it is renewable if possible. Are there gentle, natural, or integrative therapies that could help keep them comfortable at the end? For instance, acupuncture, CBD, mushrooms, massage. Yes, there are. And I know that I covered that earlier, but perhaps you weren't there at the time. But all of those that you suggest, I think, can really help them make that transition from this life to the next so much more easy. Good food, good diet, that'd be the first place I would start with anything. Acupuncture can really help with attitude and help to reduce pain. CBD, of course, as we mentioned, very good for so many different things. Mushrooms, massage therapy, hands-on Reiki, those sorts of things. Essential oils, flower essences like Rescue Remedy. There are so many tools that we now have at our disposal that when I was back in practice in the dark ages, it seems like now, really, they were very new to us and we were just getting started using them. But they've stood the test of time in terms of helping pets make this transition with some honor and some grace. What are your thoughts on vaccines and titers for adult pets? Well, I feel that vaccines have a value when you're dealing with risk. If there is evidence that there's a high risk for contracting something in the local environment that you are, and the animal hasn't been protected for that, I think it's a good idea to seriously consider that based on the health of the animal. I believe it's important with puppies to not start them so young. I'd like to wait till they're 12 or 16 weeks of age for the first vaccine until they have lost maternal antibody protection. But, if there's active, nasty diseases in your neighborhood, maybe you need to bump that up a bit. And then once you've gotten them started with as puppies, on what you decide to be the important core vaccines, and I think distemper and parvovirus are probably the two most important. And rabies is a nasty disease both for pets and people, and it's also legally mandated, so you have to deal with that. But then once you've gotten them vaccinated, and I usually recommend vaccinating them when they're not so young, but maybe 4 months of age, and then wait a year and 4 months of age, and booster them again. But if you're vaccine hesitant, I would say after we give them those safe puppy shots, and maybe separate them as well if you can, then do what's called a vaccine titer, which is a blood test that can tell you if there's enough protective antibodies for that disease. And if you get protective antibodies from that vaccine titer, then you don't need to booster. So that keeps the protection up, but doesn't have us keep feeding these vaccines into the animals that may have some toxic components in them, like mercury and thimerosal, for instance, and is only being used because they're helping to protect the health of the animal. Vaccines are strong medicine, and I think veterinarians over the years have been making a mistake by pushing vaccines instead of pushing wellness and examinations and healthy approaches. So, but there's vets can make a large markup on vaccines, but at the same time, pet parents, I don't think have been as interested, or have not been as interested in the wellness until recently, and have looked in the past, and many still do, for the least expensive approaches. And that may be budgetary, or it may just be an attitude about how they provide health care for their animals. So, for adult dogs, yes, I definitely recommend the titers. I would say we know that distemper and parvovirus in many animals last 3 years, if not more. Rabies, again, is a legal issue. But something to know is that there's several studies out there that show that the beta-glucans in mushrooms actually improve the ability of the animal to process that vaccine in a very long-standing, effective way. So it improves vaccine competence and the duration of protection. So I really recommend that you get them on mushrooms. Prior to vaccinating, and the studies show probably about a month's preconditioning with the mushrooms will help them to convert that vaccination process into a long-standing protective event, and they can also help to protect against vaccine side effects. So there you go. What's next? Will mushrooms help with Cushing's disease? Any specific diet they should follow? Well, so that's a really good question as well. And we really haven't been using mushrooms long enough in our pets to have enough exposure of them, the dogs that have Cushing's disease, to whether mushrooms can help or not. I suspect they can. I did a study regarding Cushing's disease in horses, which is similar but a little different than dog Cushing's, and we got smashing success with the horses. So I'm looking actually to work with some veterinarians who may see these kinds of cases more frequently, to have them add on the cordyceps mushroom for that. And that would be, and then from that, I'll be able to better give you information that, yes, I think the cordyceps mushroom would be good for Cushing's. But the cordyceps mushroom is an adaptogen, as is reishi. I think they'd both be good for Cushing's. The cordyceps is more palatable, and as an adaptogen, adaptogens help with the pituitary and the adrenal gland both. And most Cushing's disease in the dog and in the horse starts the pituitary, not with the adrenal gland. So by improving the health of the pituitary, I think we can have better control over the Cushing's disease as well. As far as diet, I think the diet needs to be very specific for your animal in terms of what their needs are, in terms of how severe the Cushing's is affecting them. Oftentimes, the Cushing's, which causes the body to produce a lot of its own endogenous steroids. And if you've ever had a dog on steroids, you know that it increases their appetite and their thirst substantially, and also lowers their metabolic rate. So oftentimes they will get, they'll gain extra weight. Many times their hair and skin coat will get kind of greasy, not that dissimilar from thyroid. So we need to look at a diet that would be created specifically for the way that the Cushing's disease is specifically manifesting itself in that animal. I would recommend strongly that we not use any processed foods, that we maybe work with a veterinary nutritionist to help you with a home prepared meal, or to find a diet out there that's available in the marketplace that might match your pet's needs nutritionally. Are anti-inflammatory mushrooms like reishi or chaga safe to use long-term for dogs with behavior issues related to pain or tension? Mushrooms like reishi and chaga, well, chaga is not a mushroom, but are generally safe to use for long periods of time. Chaga, not being a mushroom, and depending on how you're sourcing the chaga, can be higher in oxalates, and these oxalates could pose a problem to the kidneys. The real mushrooms chaga, we test them and we have very low oxalates in them, very safe levels of oxalates. But yes, they can be used long term in dogs. And some of the anti-inflammatory activity of both the beta-glucans in the reishi and the triterpenes in both the reishi and the chaga can also help to some degree with pain. And I assume the tension refers to anxiety. Chaga not known as much as reishi for helping with anxiety, if that's what you're referring to with the tension. But I don't see any problem with that, depending on the sourcing of the chaga and depending on whether your animal has any issues handling oxalates. Some animals are stone formers or crystal formers and can form crystals that are based in the oxalate species. So it needs to be kind of individually decided based on the animal itself. What's something most pet parents overlook when it comes to their animal's happiness? I'm not sure I know quite how to answer that one. I think that probably the one thing that maybe these days, as we find ourselves working a lot more than we did during the pandemic, maybe when we got our pets and leaving them at home, maybe in an apartment where they don't get to have a yard to be in or things like that, would be this concept of environmental enrichment, which we've discussed in previous Q&As, and I didn't really touch upon it all here. But I think providing I think you can help improve your pet's happiness while you're away and while you're at home by trying to enrich the environment. One way to do that I'm seeing these days is with using different types of feeding bowls. We're going away from the bowls, looking more at mats. Some of it has to do with how we feed them and what we feed them. I'm seeing a lot more of these dried ears and hoofs and body parts that still have the hair on them that have been like freeze dried, that the animals really love to chew on. Some people will actually take Kongs or things like that and pack them with peanut butter or some other tasty treat that the animal's looking for, and hide them around the apartment as a game for the animals to do that. I know there's some videos and some there may even be some streaming where you could actually play some music and some visual images on your monitors that could be enriching to the animal as well. Some people have like a ring type of a video thing where they can actually talk and see their animals and talk to them that way, so they feel like you're around somewhere. But that would be my suggestion. There may be other ways. It's an interesting question. I hadn't thought about it that much. So here's our code again. Been a lot of questions here. I know we're nearing the end, and I hope I've done a good job. It's kind of interesting because a lot of these questions are things that I've dealt with in my practice for many years, and I have felt that I really had a good handle on. And so I'm really glad to be asked these kinds of questions in this context and be able to kind of refresh my own memory about the importance of the things that I've been talking to you about today, especially if your four-legged friend is nearing the end of its tour here on Earth, and you're starting to think these thoughts. And there are a lot of resources out there for you now, as far as groups and things like that on the internet, where you can probably find support and you can probably find more information, much more information than I've been able to provide here in our brief little time together. But thank you so much for attending tonight.